Hello, it's Dr. Rhonda Johnson. Today is Tuesday, January 19th, 2021. And today I'm going to be talking about the COVID-19 vaccine, what you need to do to get ready, and what you need to know when you get a shot. So, over 14.7 million vaccines have been given out here in the United States. Across the world in this global pandemic, around 44 million vaccine doses have been given in 51 states throughout the world. But I want to just pause before I go on to acknowledge a grim statistic here in the United States. We have passed the 400,000 deaths from COVID-19 pandemic. I know it's hard to wrap our minds around 400,000. But I want to use this analogy that I've used several times. If you take a football stadium like Heinz Field here in Pittsburgh, where I live, it would take 6 stadiums to hold the number of people who have lost their lives. 6 stadiums the size of Heinz Field that holds around 67,000 people. That's what we're talking about. So I wish to remember the people who died from COVID-19 and their families. And hopefully we can prevent another tragic loss of life like this year in 2021. So let's talk about what's involved in getting the COVID-19 vaccine. Again, this vaccine is voluntary. No one can make you take it if you don't want to take it. And you have to be 16 and up to get the Pfizer vaccine and 18 and up to get the Moderna vaccine. So basically, I'll give you a high-level overview. You go in, you have to first get an appointment, and every state is different as to how they're rolling out the vaccine. So you should really check on the health department website or call your local health department. They should have information, or call your doctor. It's so important to have a relationship with a primary care doctor. Between your doctor, your health department, or word of mouth, you should be able to find out information on how to get signed up for the vaccine. So when you get there, once you have an appointment, you usually need to bring your appointment notification. If it's on your phone or if it's a piece of paper that you print off your computer, bring your appointment. You have to bring your photo ID with you and proof of your appointment at some of the locations. If you're getting it at work, you may need to have your employee badge on. The vaccine is free, so you should not be asked to pay any money. Now, most likely you won't have a choice as to whether you get the Pfizer or the Moderna vaccine, but both are very similar. The difference is the next dose. For Pfizer, the second dose is 21 days after the first. For Moderna, the second dose is 28 days after the first dose. Now, many people want to know, should you fast or avoid any food or certain drinks before your vaccination? No food precautions are required, but you should stay well hydrated prior to the vaccine. Next question. Do you need to worry about getting the coronavirus? Well, the vaccines are in a public place, so you'll need to mask and have your hand sanitizer with you so that while you're waiting for the vaccine, you'll be safe. And again, these places are doing their best to do social distancing, so hopefully you won't be waiting in a long line somewhere to get your vaccine. Now, after you get your shot in the arm, you'll need to wait 15 to 30 minutes to make sure you don't have an adverse reaction or an allergic reaction. And if you are the kind of person that feels faint after you get your blood drawn or your other kind of vaccinations, immunizations, then my guess is, or if you feel a lot of stress and anxiety about getting a shot, go with someone, have someone with you. if at all possible. Now, will you get a record of your vaccinations? Yes, and please keep that piece of paper where you keep your important papers like your driver's license or your passport, because you may need that piece of paper if you should travel somewhere. You may need it for certain jobs, proof of immunization against COVID-19. And you may need it to get your second dose. So please put your vaccination card in a safe place. Will you experience any side effects? Well, some do, some don't. But most people are having local reactions, meaning pain at the injection site. Some may have fever, some may have chills, some may have muscle aches, some people may have headaches, and again, some people have full-blown allergic reactions. It's so hard to know. That's why you should check with your doctor prior to getting the vaccine and make sure that you don't have any contraindications to getting this vaccine. Now, are you protected after the first shot? No. You need 2 doses of each, the Pfizer and the Moderna vaccine. And you should have full protection after 2 weeks after getting the second shot, the experts say. So it takes 2 weeks after both shots to be protected. Now, will you still need to wear a mask and wash your hands and socially distance after getting vaccinated against COVID-19? Yes, you will. You will need to continue doing all of those things. And remember, too, that you could be exposed to coronavirus, get infected with coronavirus, and can transmit the infection to other people because the virus will live in your nose and your throat. So you will need to wear a mask in the presence of others. Okay, that's my message for today. I hope it's been helpful. Again, this is for people who've made their mind up. I'm not trying to convince anybody to get the COVID-19 vaccine. That is a personal health decision and one that you should make in consultation with your family and your physician. This is Dr. Rhonda Johnson. My views are my own. Stay safe and have a blessed day.